I'm Laura Berkner. I'm a physician assistant at Monroe Clinic. I first wanted to, actually was interested in medicine back when I was in college, the first time, but instead I decided to get married and have kids instead. And in the meantime, I have had a couple of kind of interesting careers. I've worked in food and meat industry as an inspector and a supervisor and a scientist, and I did sales for a couple of years. And then I decided that really my true love was medicine, and that's what I needed to be in. So I always joke I went from meat to makeup to medicine. You know, the thing for me is medicine is a final choice. It was really what I finally figured out what I should be doing. I've tried many other careers and I've been happy in them, but medicine for me has been the place where I truly can express that ability to care about people and to make a difference in the world. I was able to do a 2-week medical mission trip to Guatemala, and it was just a life-changing experience in what we were able to do and the patients we were able to see. And it does help me keep me grounded here when I see patients and I realize what we are able to provide and the great medicine we can deliver on a daily basis. To me, it's great. I would like a patient to come to see me for not just their routine health care. You know, a lot of times people miss that, and if we can prevent a problem, that is so important. A lot of times a disease will be building and people won't have symptoms, and if we can catch and treat it early, it can really help affect the quality of life for people. But also anytime that there's something acute going on or something that they really need treated, they should come on in. I think the hardest part about my job is sometimes convincing people to do what I think is the right thing for them to make them healthy. That might be a really scary thing for them to do. And getting people to make the changes that are good for them. You know, change is difficult for all of us. And so how do you convince somebody that doing something that might be hard now will make a big difference later? I recently saw a patient that hadn't seen a physician in probably 15 years. And I saw her in a different setting and convinced her to come in and seek care. And to see her a month later feeling so much better and not afraid to be treated and not afraid to see a doctor now, it's hugely rewarding. It was great. The thing I'm most proud of, frankly, is my family. I love my kids. I have 2 adult sons that are, oh gosh, doing math, 23 and 20. And then I have 2 fabulous stepkids that are 17 and 16. And they keep me grounded. I love my husband, so he really helps keep me grounded. And of course, I always joke that I have 2 extra fur babies. I have 2 dogs that I love and drool on me occasionally. So I always sort of warn my patients if they see something, they should tell me.